Order, order. I call Richard Ford to move the motion.
Thank you, Mr Vickers, and it is a pleasure to serve under your chairship. And I'm very grateful to Ways and Means to have been granted a debate today on NHS dentistry in the southwest of England, which has got particular problems. Now, I know that the new minister will have encountered enough problems as it is with NHS dentistry in the round, but the southwest is a special case. To illustrate, if we were to go back to 2015, that was a time when 51% of adults in the southwest could see a dentist. And that was the case across England at the time. 51% of patients wishing to see an NHS dentist could have access to one. But by 2024, that figure has declined sharply. Now the current average across England is 40%, but in the southwest it is just 34%.
Would you give way?
I will.
I thank the Honourable gentleman for giving way and securing this really important debate. But the percentage of adults that have seen a dentist in Somerset has dropped by 20% over the past decade. So does the Honourable member agree with me that we should guarantee access to an NHS dentist for everyone needing urgent and emergency care?
For urgent and emergency care, I think that is exactly what is needed. The Honourable Member draws attention to Somerset, and the situation is bleak in Devon too. In Devon, in 2015, 55% of adults were able to see a dentist, but that has since dropped to just 37% today. Now, I have had so much correspondence from my constituents on this subject. The decline, as I see it, is a direct result of 14 years of conservative neglect of our health services and of NHS dentistry in particular. What I find really troubling is that this is affecting people in some of our most vulnerable categories. It's affecting older people. It's affecting children. Children in Devon are missing out on crucial dental checkups. They used once upon a time to have checkups twice per year. It is now not possible for children to be registered with many dental practices for NHS dentistry. And so it's no surprise that tooth decay is now the leading cause of hospital admissions for 5 to 9-year-olds in the country. I've been talking to one primary school that told me they've got pupils going to a hospital in Bristol to have teeth removed, often between 4 and 10 teeth removed at a time. And the number of NHS dentists has dropped in Devon from 549 to 497. And so the reality is that NHS dentistry is simply no longer available for all. I will.
I thank the member for giving way. I accept the points that have been made entirely in relation to Devon and Somerset. In Cornwall, in my constituency of Camborne, Redruth and Hale, we have some of the most deprived areas in the country. I've met people who have chosen to access dental care privately at the expense of heating their home or eating food. This is where we are today. We're in a dental emergency across the southwest. In Cornwall, it is now critical. Does the Right Honourable Member agree with me that we cannot wait any longer for emergency dental care across the southwest?
Ford.
He's right. We want to move NHS treatment back into primary care and away from the most critical acute care, and yet it seems to me that the primary care services are moving in the other direction.
On that point.
Yes, I will. The Honourable Member for Bath.
Thank you. Thank you for giving way. The Royal United Hospital in Bath saw nearly 260 people last year with serious dental issues like abscesses. And this is largely because they couldn't get a preventative care appointment from a dentist in their community, forcing them to go to A&E. And does the Honourable Member agree that a lack of NHS dentistry drives up costs because people go into A&E when actually A&E should only be there for emergency cases?
Richard Ford.
I have to say I do agree with the Honourable Member for Bath that emergency care should not suddenly become the routine. It is there for the most critical cases, and we've not seen that given the drying up of NHS dentistry in our towns and villages. I will.
Do you not, though, agree that part of the problem that we're talking about is that we're only talking about emergencies? The Secretary of State in his first week talked about the fact that they were working hard to look at preventative medicine, and this should apply to dentistry as well. Would my honourable friend not agree that we need to be looking at a serious timeline for when the dental contract gets reviewed? We cannot only be talking about emergencies all the time.
She makes an excellent point. The desire to have prevention is clearly cheaper than to deal with the problems down the line. And there is no better example, I think, than offering checkups for children's dentistry. Yes, I will.
Thank you. I find it absolutely shocking, and I'm sure you'll agree with me, that the previous Commons Health and Social Care Committee report, and I'm talking 15 years ago, the recommendations they made have still not been implemented. 15 years.
Forward.
Well, the honourable member for Tiverton and Minehead has clearly done her homework, and that is quite staggering that recommendations from that long ago are still not implemented.
Further example?
I will give way to the member for South Devon.
Thank you very much for giving way again. Lord Darcy raised in his review of the NHS that urgent action is needed to develop a contract that balances activity and prevention. That this contract must be attractive to dentists and reward dentists who practice in less served areas like mine in South Devon, where there isn't a single dentist taking on NHS patients anymore. Would my honourable friend agree that we urgently need a timeline for this work to be done?
Forward.
I do think so. The honourable member is right to point to some of the recommendations in the Darcy report. And I was quite encouraged to see reference to neighbourhood hubs, where perhaps we can have delivery of primary care, such as NHS dentistry, nearer to the constituents who we represent. Yes, I will.
First of all, can I commend the honourable gentleman for Honiton and Sidmouth for bringing this forward. Does the honourable member not agree that the story in the South West is something being replicated across all the United Kingdom, Great Britain and Northern Ireland? He may not be aware. A survey of almost 300 dentists in Northern Ireland found almost 9 in 10 intend to reduce or end their health service commitments in the coming year, and that could be the end of NHS dentistry. Is he experiencing the same thing in the South West? And if he is, then government must really grasp this issue, as the honourable lady has referred to, and get it done.
Forward. Well, I'm glad that the honourable member for Strangford made that point, because I didn't know the case of Northern Ireland, but it sounds like there are some regions of the UK that really are not getting the attention that they require for NHS dentistry. I want now to share the story of two of my constituents, Mike and Shirley. They're residents like many others. I've had correspondence from Martin Loveridge, another who's experienced something like this. Mike and Shirley are hard-working people. Mike, almost 75, after more than 50 years in horticultural work, and Shirley, who's still at age nearly 70, taking on part-time cleaning work to make ends meet. In 2023, their dentist in Sidmouth finally went private, driven away by the broken dental contract that we've heard described in this debate today. And the impact of this shift has been devastating. Shirley developed a dental abscess. Now, for anyone who's had a dental abscess before, you know they will know what excruciating pain that can involve. And years ago, this led to a similar infection leading to sepsis for Shirley. Instead of receiving urgent care from the NHS, Shirley faced the choice: either wait in pain or go private. Now, plainly, this one incident is a pretty standout case, given it's very crucial that she received that NHS treatment for sepsis. But typically, it would cost them £1,200 in dental fees, a sum that is simply unaffordable for people in their position. Mike now has not seen a dentist since May 2022 because he cannot simply afford it. They tried to get NHS dentistry. They went to NHS England. They went to Devon Health Watch. They went to the complaints department at NHS Devon. They had people admitting to them the dire state of the system, but were offered no real solutions. They spent hours on Find an NHS Dentist, a website just for this very purpose, but they were referred to a clinic that was 80 miles away, an impossible journey for Mike and Shirley. Yes, I will.
I thank him for giving way and securing this important debate. Cheltenham is similarly a dental desert, and my residents often find themselves being referred out of our region into the Midlands for treatment as far away as Malvern, if they're not lucky enough to get somewhere in the Honourable Member for Gloucester's area. Would he agree with me that that is simply wrong and unacceptable, and would he also join me in thanking the community campaigners in Gloucestershire, including Councillor Paul Hodgkinson, the health lead for the Lib Dems on Gloucestershire County Council, who are trying to fight this at the local level?
Well, the Honourable Member for Cheltenham is right to draw attention to community campaigners, but frankly it shouldn't require grassroots organisations to self-organise and mobilise. This should be something that, as representatives and as government, we should be able to provide in this, the 6th richest economy in the world. 3 years ago... Yes, I will.
I thank the Honourable Member for arranging this debate and for his forbearance at the incredible number of interventions taking place. On that point of what the government can do to intervene, does the Honourable Member agree with me that to really solve this problem once and for all and not just deal with the emergency situations that our colleague raised, the government needs to move towards a model where dentists are reimbursed for their work in a similar model to GPs, where they are rewarded for caring for patients and taking a more preventative approach?
I do think that NHS dentists do need to be rewarded by an NHS dental contract that recognises that not everybody has the same ability to pay. And frankly, there are some of our constituents who, with a little bit of money invested early in preventative measures, would not be costing the system nearly so much later. At a Westminster roundtable on dentistry last year, it was made plain that the issue was not so much about a shortage of dentists, but a need to attract private practicing dentists to NHS work. Many dentists, even those who would ideally prefer to work within the NHS, are avoiding it or leaving it because the current system is not fit for purpose. On Remembrance Sunday, I was talking to a couple near the War Memorial in Sidmouth. They were both veterans. They had served between them for 62 years. And they were unable to get NHS dental appointments. They felt that they had dedicated their lives to public service, and this was how the state was rewarding them.
Would the Honourable Member give way?
Yes, I will.
Thank you very much for giving way, and thank you very much for securing this important debate. I'm sure that the issues in the South West are just as similar and as challenging as they are in Wokingham in Berkshire. The Commons library data states that only 32.6% of children in Wokingham have seen a dentist in the last 2 years, compared to a 40.3% figure for the whole of England. Both figures show the Conservative Party legacy of rotten teeth, fillings and agony. Arborfield and Swallowfield in my constituency are without dedicated dentists. It simply isn't good enough. Does my honourable friend agree that the NHS primary care needs to be properly funded?
Richard Ford.
Well, I'm appalled to hear about the examples that the Honourable Member for Wokingham has let us know about today. And I think the really disappointing thing is that some of the expense that we see in secondary care could be avoided with a little bit more investment upstream in primary care. There's a clear disparity between the work that dentists are doing in the NHS and that which they're doing in private practice. There is so much more emphasis in private practice on preventative care, and we need to see this same level of preventative work happening in the NHS. At a debate last week, an adjournment debate in the main chamber, I was struck that there were many of us there who were seeking to draw attention to NHS dentistry, but that not a single Conservative MP attended. I do want to thank the Minister and the new government for really showing more commitment to NHS dentistry than the last administration. And yet we have got further to go. With the budget, we saw the government prioritise the NHS, allocating an additional £25.7 billion to the NHS. But in the budget, we need more reference to dentistry. In the Labour Party's manifesto, they talked about a dental rescue plan that would provide 700,000 more dental appointments and, most critically, focus on the retention of dentists in the NHS. We urgently need to see that. We urgently need a dental rescue package to bring dentists back to the NHS, and particularly in the South West. We have a dental training school at Plymouth, and we understand that dentists, once trained, often stay where they have gone to university. And so we need more dentists to be attracted to the South West and to stay in the South West once they are there. Yes, I will.
I think it's important to look at local government and the role of public health in local government as well. So Better Health North Somerset has a really great programme led by Catherine Wheatley, which is all about promoting oral health, just as the Honourable Member referred to, in early years and children and young people. So, and one of the things that I have noticed is how what works and good practice is not often shared across ICBs, shared across our local areas. So with the strength of feeling here, as you can see by the amount of our South West MPs that have attended, there's a real opportunity for us to collaborate and share on what works. So I think that would be really useful.
I agree, and I do feel that one way in which we can share best practice is by thinking not only about training places, but also around the recognition of qualifications. What we saw after the UK's exit from the European Union is a breakdown in EU dentists wanting to stay put here or be attracted here. And so we've, with there being fewer Eastern European dentists, for example, in the southwest of England, we need, I think, to look again at dental qualifications and whether we might recognise some of the dentists' qualifications that might make being in the UK as a practising dentist more attractive. So, Mr Vickers, to bring my remarks to a close, the rural southwest of England needs to be able to expect the same level of provision in NHS dentistry as we see in urban areas across the country. And specifically when the Minister responds, I'm curious to know, will he be committing to reform of NHS dentistry such that constituents like mine, like Mike and Shirley, for example, don't have to go into the red or forfeit heating their homes so that they can have dental care that means that they can avoid being in acute hospitals like the RD&E at Exeter. Thank you.
May I remind members that if they wish to speak, they should bob, and if they could limit their contributions to an absolute maximum of 4 minutes, we'll probably get everyone in, but it's going to be a squeeze, particularly if there are too many interventions. The question is that this House has considered NHS dentistry in the South West. I call Tom Hayes.
Thank you, Chair. My constituent Jonathan Carr-Brown recently went to his dentist for his routine checkup. Dr. King seated him in the dentist chair, as he had done many times before, and he felt his throat, as he had done many times before. Unlike those other times, Dr. King found something. He found a lump. After that visit to Bournemouth Dental Centre and following further investigations, a tumour was identified. I saw Jonathan at the weekend, and he had just completed a course of chemotherapy because his dentist helped to spot cancer. He was doing well, if a little tired following his treatment, but he was not too tired to talk passionately about the importance of dentistry within our wider healthcare and how more lives could be saved with the right changes by our Labour government. Jonathan's story shows the potential of so many things, including co-location, the promise of innovation, the possibilities of integration. Imagine if Jonathan had been able to go up the corridor to get diagnosed even faster, to receive the right kind of support even faster. Jonathan's story shows the power of prevention. There are so many people in my constituency of Bournemouth East who are struggling to get the routine appointments that can spot problems and fix them sooner. Of course, we need more appointments. Of course, we need more workers. But we also need to have a rethink of who does what. In my constituency, as elsewhere, I know the potential for local hygienists and therapists to use the full scope of their practice. Indeed, for Bournemouth to pilot a new model of therapy-led practices, with dentists covering only that work that sits outside of scope. I would welcome investments in the training and development of an oral health team that can learn by doing, providing clinical and preventative services to people who need them. And in Boscombe, in Bournemouth East, right now, Health Sciences University could help to increase local people's access to oral health care by training even more professionals for the future and getting support to people who need it, bringing down the waiting list while also training people up, in particular providing outreach in areas of deprivation. There are so many areas of policy that we could focus on. I would love to talk at length about the reform of the dental contract, but I'm hoping that other colleagues will do that. That being so, I'm going to talk about how we can focus on the importance of empowering people by giving them accurate and clear information about NHS dentistry. The NHS app and nhs.uk website are managed by the NHS Digital NHS Business Services Authority. There's quite a lot of sayings of NHS there. It is the responsibility of NHS contractors to update for their specific provision. This means that there is not any kind of oversight or meaningful guarantee of accuracy of information. In April, before the general election, my team rang around all the surgeries in Bournemouth, currently offering spaces to new NHS patients, and discovered that many hadn't updated their details, sometimes for years. Since then, indeed perhaps prompted by my team's calls, there has been a small number of updates. But most of the surgeries that were showing not updated details recently were private, only offering private appointments who seem baffled to have been rung by somebody looking for NHS care. It isn't just that time-poor people desperate for dental care might be accessing incorrect information. It struck me and my team that people could be ringing surgeries listed on NHS platforms for NHS care and not listed as private dental providers who, when unable to access the NHS care and so desperate for any kind of care, might as a consequence be buying into private dental provision. When we checked this out with the NHS, they had no way of determining if patients commit to dental provision that's private or what service members of the public may be offered. When we checked this out with the NHS, we were told that although so many private surgeries were not listed as private on the website and digital platforms, the NHS could not comment on the advertising of private dental providers. And indeed, in April, under the Conservative government, we discovered that there were no new NHS places available in a dental surgery in Bournemouth. Things have improved slightly since then, but only slightly. We need to improve the accuracy of the information that we provide to our public by putting in place the right mechanisms. We need to be strengthening our digital platforms to ensure that citizens can book appointments, get personalised notifications to book routine checkups, and compare waiting times and patient satisfaction scores. Lastly, we need a digital health record as a single source of truth about someone's health. Whereas this information is fragmented across pharmacies and GP surgeries and dental practices and hospitals and people's phones, how much better would it be if it were brought together so that someone's medical record was in hand and complete when they were seen, allowing them to be seen by the right person at the right time in the right setting? Our NHS was founded on the principle that health should not depend on wealth. However, people who can pay are paying, and the use of private healthcare will continue to rocket, perhaps even by unintended encouragement by our NHS platforms, unless we co-locate, innovate and integrate. A healthy population will unlock a stronger Britain, and I look forward to supporting the government with its efforts to change our NHS dentistry, so that they can survive and serve our public.
MP representing a rural constituency in Somerset, I don't need to repeat the well-known fact that the South West is one of the worst dental deserts in England. As a mum myself, and someone whose granddad was a dentist and so who as a child received excellent dental care, I particularly worry about the effects of this on children. With such a scarcity of NHS practices accepting new patients and the rising cost of living, working families simply can't afford to go private. This means that more often than not, parents have to unwillingly forfeit their children's health. We know this is a topic that people care about up and down the country, and it's one that I receive regular emails about from my constituents in Freeman East Somerset. Normally with the same regrettable situation: can't get a space, no room anywhere in the vicinity, and forced to go to hospital. However, one casework email I had recently was particularly stark. A retired man and his wife who have recently become kinship carers to their 2 grandchildren following the sudden death of their daughter. Whilst one child had luckily already started orthodontic treatment prior to their mum's death, the grandparents cannot find a single NHS practice that will onboard the other child. They receive the state pension and one-child benefit. Luck should never be a factor in the question of children's health, let alone set two siblings apart. NHS dentistry should be there to level the playing field and give access to all, regardless of their background or family setup. Having met with local dentists and national dentist groups, the growing consensus on why there are so few spaces in the NHS dental practice seems to be twofold. One, budget, and two, the availability of NHS dentists, with many leaving the NHS or dentistry altogether because of low morale and stress. Recruitment is already difficult, but retainment even more so. NHS has been chronically underfunded, and the UK spends the smallest proportion of its health budget on dentistry of any European nation, with England spending almost half less per head than other parts of the UK. Just as working families in the South West are struggling with the rising cost of living, high inflation, energy costs and everyday household items, so are NHS dental practices. This chronic underfunding has coincided with rising overheads. Most notably, the rise in employers' national insurance contributions announced in the budget will severely impact NHS dental practices already on their knees. This tax rise will significantly affect health and care services for patients, and the Liberal Democrats fear it will only make the crisis in our NHS and social care sector even worse. We've urged the Chancellor to urgently rethink the rise in employers' NIC and national insurance contributions, either by cancelling them for all employers or at the very least exempt those providing vital health and care services, including GP services, dentists, social care providers and pharmacies. Without this exemption, the health and care crisis will only worsen and regional disparity will widen. Children in the South West region will depend on luck or good fortune. Parents will feel helpless and be forced to make sacrifices, and it risks setting apart and back thousands of children.
I won't rehearse the numbers that people have already spoken about in the South West, other than to say fewer than half of the children in Cornwall were seen by an NHS dentist in the last 12 months, and that's down 13 percentage points when compared to 5 years earlier. It's just getting worse and worse, and you now simply can't get an NHS dentist in the whole of Cornwall. It is impossible. We are fortunate in that we have a new government. We are looking at 700,000 new urgent appointments, and everybody recognises that that contract needs reforming, and there is a commitment to reform the contract. Obviously, that will take time. So in the meantime, we maybe need to look at what can be done locally. Now, in Cornwall, our commissioning of dentistry has been passed down to the ICB, and they have done some quite innovative things. A surgery in Lostwithiel that was just about to hand its contract back, they went into some bespoke negotiations so that the under-18s and the elderly and vulnerable people could retain their NHS dentist. So there is the option within the contract that we have for local ICBs to do more, to go into bespoke negotiations and maybe to salvage some of these things in the meantime while we are waiting for the large renegotiation of the dental contract. So there are other things that I would ask the Minister to consider, and I'm sure he has done, and whether he could speak more in his response about the idea of health hubs, of those, more of those bespoke contracts, and how much power the ICBs have to enter in those contracts, and looking at things like emergency dental vans, which I understand are a sticking plaster, but have been used in some places.
Vicky Slade.
Thank you, Mr Vickers. It's a pleasure to serve under your chairmanship. And it's interesting that my honourable colleague has just mentioned the dental vans. We were due to have one in Dorset. But I heard from my local dentist, NHS dentist in Corfmullen, that they were seriously concerned about the prospect of having a dental van. They were worried that if they were to take it out to their rural community, there would be mayhem and frustration with people who hadn't seen a dentist in so long that they were actually in fear for their staff and decided that they didn't want to take the dental van. They also noted that it was 2.4 times more expensive than operating a practice, and so they decided that they would invest their extra money that they had as a practice in an additional graduate dentist. I met her name was also Vicky. I met her a few weeks ago and really excited about the work she could do, particularly in the health of children. The decision, though, to increase national insurance and not exclude dentists means that half of her salary is now going to go on the additional national insurance for the staff within that practice, which is jeopardising the opportunity for practices like Corfe Mullen Dental Surgery to take on such staff. Just returning back, it's interesting, isn't it, that dental care was available on the NHS from its very inception, and that the original advert for the NHS stated that it would provide all medical, dental and nursing care for everyone, rich or poor, man, woman or child. And I'm sure that Beveridge and Bevan would be turning in their graves if they thought adults would be pulling out their own teeth and that children were being hospitalised for tooth extraction. It's already been described that there is less than a third of our adults in the southwest are receiving dental care, and when we describe it as a desert, we're not talking about our wonderful beaches. It is genuinely a dental desert. I find it really hard because NHS Dorset have actually told us they have a £9 million underspend in the last year, and yet people are spending hours on the phone begging for help. I was pleased that our ICB has approved an increase in the price of the UDA, the Unit of Dental Activity, but why is it being delayed until next year, and why aren't they going further? Why is it that our hospital can go out to a private hospital and sort out all the knee replacements and find the money for that, but our dentists can't actually be brought online to deal with the urgent cases? I would like to ask the Minister if he can instruct ICBs across the South West and beyond to ring-fence the underspend in dental budgets so it can't be used to plug the gap elsewhere in the service while people are struggling. Katie in Bearwood told me that she is going to lose her front tooth if she doesn't get help soon. She wakes up every day with blood on her pillow and all over her teeth. The pain is so unbearable that she is in tears and has lost 2 stone in weight as she can barely eat. She can't get a referral to hospital without paying to see a private dentist. She's ashamed to go out in public. She said that she had to pay £1,000 in private costs before she can be seen, but nobody will give her a loan. Zoe in Wimborne told me it had been 9 years since she'd seen a dentist. She told me that she was close to using the old-fashioned method of a string and a door. This is absolutely ridiculous. It cannot be allowed to carry on. And I can't not tell you about the children in our area. So it's wonderful that the government is bringing in supervised toothbrushing. I think that's wonderful. But what is the point if the children then can't see a dentist? I was mortified in 2022 when I took a foster child who had come to live with me to my dentist. I had assumed that, as with GP practices, looked after children would automatically be added to a family's NHS practice. How wrong was I? We didn't realise this, so we insisted on telling the dentist they had to see this child. He was 11 years old, he had 7 teeth gone already. He needed those teeth replacing for his future and for his smile. And if we cannot do it for the adults, we must at the very least do it for our children, and especially for our looked after children.
About the parlous state of NHS dentistry in our city after 14 years of Tory government, which allowed NHS dentistry to fall into complete disrepair. We've heard across the room today that the South West is one of the most notorious dental deserts in England, but I think most troubling is indeed, as we've also heard, the proportion of children that don't get to see a dentist. So in Devon, that's dropped by a fifth, from about 61% of children in 2016 to 47% in 2024. And that's well below the English average of 55%. The reality of this is truly shocking. Across the country, tooth decay is now the #1 reason children are admitted to hospital, and over 40,000 children in 21-22 had teeth removed at hospital across the UK. That's the case in Exeter too. The Royal Devon University Healthcare NHS Foundation Trust states in its annual accounts that tooth decay is still the most common reason for hospital admission in children aged between 6 and 10 years old. And according to the Oral Health Survey of 5-year-old children, more than a fifth of children in Exeter, 22%, have tooth decay by the time they're 5. I talked to one of my local primary schools in preparation for this debate to get their view on this too. They said to me that they know of multiple children who've had teeth removed due to lack of dentistry and then having to miss school. Some of their children have joined reception with all of their teeth brown or blackened stumps. They have children missing school due to being in agony from toothache and having no dentist. And many families, and indeed teachers, are unable to find an NHS dentist that will take them on. And this is truly shocking. And as with many things, our primary schools do what they can to pick up this slack. This particular primary school teaches children already how to brush their teeth and do so each day in reception. Therefore, Exeter's NHS dentist crisis is not just having a detrimental impact on people's teeth and their health, it's having a detrimental impact on children's education and obviously on our economy too. It's also having a detrimental impact on our local A&E department, which is already stretched to capacity. Tooth decay for 740 patients in total to attend its emergency department between April 22 and March 23, according to NHS digital data. When comparing NHS regions, those in the South West and the South East will least likely to have an NHS dentist and most likely to have a private dentist, and given the cost of simply being accepted onto a private dentistry register can be upwards of £70 a month for a small family before treatments are added in. This is clearly also a cost of living issue for many families. Now, across the South West, the NHS dental budget, as referenced already, is underspent and by over £86 million, in fact, between 23 and in financial year 23-24. And this is, of course, not due to any lack of demand, but largely due to dental practices unable to work under the current NHS contract, which simply does not cover the cost of treatment, meaning that we're asking dentists to deliver NHS services at a loss, which is clearly an unsustainable situation. And instead of seeking to provide flexibility in the dental contract, as I know some ICSs do across the country, it seems that Devon ICB simply reallocates that dental funding elsewhere in their budget, despite the fact it's supposed to be ring-fenced. This is causing us further issues in Devon, as the BDA informs me that dentists are leaving the NHS in their droves. In Devon, we saw a 9% drop in the number of NHS dentists last year alone. Now, my residents welcome the fact that this Labour government has pledged to provide an extra 700,000 urgent dentist appointments and reform the NHS dental contract as part of a package of measures to rescue NHS dentistry. And I know that the department is working at pace to roll out those 700,000 extra urgent dental appointments and to pave the way for a new reformed dental contract. I met with the chair of the BDA recently to talk about Exeter specifically, and he stressed that NHS dentists, who are stung by the many broken promises from the last government, need this Labour government to deliver meaningful change, including a clear timeline for negotiations. Now, I know that government clearly treats NHS dentistry extremely seriously. The Health Secretary made the BDA the first organisation he met with after the election. I was pleased to hear the Prime Minister say at PMQs recently that he would work as quickly as possible to end the current crisis. And given what I know and what we've heard today from my constituents in Exeter, that change really can't come soon enough. Thank you.
I congratulate the Honourable Member for Honiton and Sidmouth for securing this vital debate about NHS dentistry in the South West. As has already been said, the issues with access to NHS dentists are known only too well by my constituents in South West Devon. Since 2020, the number of dentists in the county has fallen from 549 to 497. This means that each remaining dentist must see almost an additional 300 patients every year. It is obviously clear that we have a significant shortage of dentists in Devon. Only 34.7% of adults in the county have seen a dentist in the last year, which compares to 55% 10 years ago. And as we've also heard from the Honourable Member for Exeter, very few children are also seeing dentists. 46.6% of children in Devon in the last year, which compares to 61% in 2016. If you live in or around Ivybridge in my constituency, there are currently only 2 dental practices within a 10-mile radius accepting new patients. This only gets worse for the more rural and coastal communities, and indeed the statistics are not good for the communities within the Plymouth boundary. However, I am aware that one anomaly within Devon is the fact that there is actually a waiting list for NHS dentists. At one recent meeting with local senior health officials, it was pointed out that Devon's waiting list is very unusual and perhaps even unique. We have 60,000 people on that list believing they are entitled to an NHS dentist, when, as was discussed at the same meeting and what I was led to believe on the day, the existing NHS contract was only designed to serve 55% of the adult population, the assumption being that others would access dental care privately. Now, I'm not making a judgment on whether that's right or wrong, I'm just stating the fact that most people don't actually understand that. And actually, the dental system was set up to be more like an optician than a GP at the time.
So the issues that we currently face in Devon have in many ways gone beyond these points being particularly relevant, but I do think it is perhaps worth reflecting how important it is that we are honest with people going forward as we make changes to make sure that they understand what the impact of those changes might be for them. Before I reach the main point I wish to raise today, though, I want to briefly mention two challenges faced in Devon: how we train dentists and how NHS contracts are awarded. Devon is fortunate, as has been mentioned already, to have an outstanding dental school at the University of Plymouth. When it opened, many believed it would provide the city and the region beyond with a ready supply of new dentists to help us tackle our dental shortage. However, the school is so successful that it is incredibly difficult to secure a place to study there, which has an impact on local people being able to study at home and perhaps stay after graduation. Equally, I've been informed by an expert on dental training that how we train dentists makes it very difficult for people to stay where they have studied. So those local dentists may not actually, the non-local dentists, so the ones that might be coming down from the Midlands, the system at the moment almost forces them to go back to where they came from rather than staying in the southwest if they wanted to. So I would urge the Minister to look into this issue to see what more can be done to ensure that students can more easily stay where they have studied, because at the moment, even if you fall in love with Devon as a dental student, it is very difficult to stay and help us solve our problems. Secondly, I'm concerned about the lack of flexibility in the awarding of new NHS contracts at a time when we are in desperate need of more dentists. I was contacted about a year ago by a dentist seeking to open a practice in my constituency who was told by the ICB that the window for applications had closed. Now, that may have been the case, but given the fact that we are in such dire need of dentists, perhaps there could have been an exception made. That leads me finally to the main point that I wish to make. In the last 12 months, 876 people attended the emergency department at Derriford Hospital for a dental reason. 18% were under the age of 20 and 82% over 20. That is an average of 2.4 people per day having to resort to using the emergency department to access dental care. Of these patients, 77 were then admitted for treatment. What I would just like to say to the Minister as I close is that is why we need to see the stalled Future Hospitals review of Derriford Hospital's urgent and emergency care funding provided, because it's part of that bigger picture of how we provide dental care across the South West. If we're freeing up emergency, we've got more capacity to be able to look after the region more fully. Thank you, Mr. Chairman.
McIntyre.
Thank you, Mr. Vickers. It's an honour to serve under your chairmanship, and I'd like to extend my congratulations to the member for Honiton and Sidmouth for securing this important debate on NHS dentistry in the South West. NHS dentistry stands at a critical crossroads, facing the most challenging period in its history, and a recent report from the Nuffield Trust described the threat to NHS dentistry as existential. Under the previous Conservative government, NHS dentistry was put under immense strain. With only enough dentists to serve half the population and a severe shortage of investment, the Tories left Britain with one of the smallest dentistry budgets across Europe. At the start of this year, a staggering 13 million people were unable to access NHS dental care, over 3 times as many as before the pandemic, and tragically 7% of adults have resorted to the most desperate of measures, performing DIY dentistry, including pulling out their own teeth. Now, in the South West, and particularly in my constituency of Gloucester, the situation is deeply concerning. The region is one of the worst dental deserts in the country, as we have heard today, with just over a third of adults in the South West having seen an NHS dentist in the last 2 years, and in some cases people are waiting up to 4 years for an appointment. The effects on children, as we've heard, are particularly shocking. In the South West, only 1 in 2 children were seen by an NHS dentist in the last year, well below the national average. This is a disgrace. We are seeing an increasing number of children suffering from tooth decay, to the point, as we've heard today, that the most common reason for hospital admissions amongst children aged 5 to 9 is to have their teeth removed due to rot. In my own constituency of Gloucester, 2 in 5 constituents are facing significant delays in accessing dental treatment, with many unable to see an NHS dentist at all. And I heard some of these challenges firsthand at a visit to the Bupa surgery on Painswick Road in my constituency. Sadly, Gloucester falls below the national and South West averages for children and adults seen by a dentist, and it has one of the lowest numbers of dentists in England. Families across Gloucester are suffering. Plans are afoot to change this, and I've had positive early discussions with the ICB and the University of Gloucestershire about their plans to establish a new dental hub at the University of Gloucester's new campus in the city centre, which is very exciting for my city. But I'm also aware that we need long-term change and investment from the government to ensure that we meet the current challenges in NHS dentistry and to reverse the worrying finding that 60% of NHS dentists in England have considered leaving the profession. That's why I'm proud to support the government's plan to fix NHS dentistry to deal with the immediate crisis. And the government have committed to providing 700,000 additional urgent dental appointments to tackle that backlog and provide immediate relief to those suffering in my constituency. And I look forward to the Minister's update on that in his closing remarks. I know that this Labour government is committed to providing the necessary investment and reform to ensure our dental services are fit for the future. But these measures are desperately needed in Gloucester and across the South West. Thank you.
Thank you, Mr. Vick. It's a pleasure to serve under your chairmanship. I'd like to congratulate my honourable friend, the member for Honiton Sidmouth, for a really genuinely important debate, and also, of course, my honourable friends and members for Glastonbury and Somerton, Frome and East Somerset, Bath, Tiverton and Minehead, South Devon, Chippenham, Wokingham, Mid Dorset and North Wall, to say but few, and the members opposite for their contributions as well. It's an important debate. In 2022, about nearly 3 years ago, I launched a campaign, a survey rather, of dental provision for the NHS, from the NHS in my Taunton and Wellington constituency, long before I was a Member of Parliament. And back then it showed that less than half had access to an NHS dentist, and now, nearly 3 years on, things have just got incredibly worse. 64,000 children in the county and did not see a dentist last year. It puts us within Somerset, within the worst hit 5% local authorities in the country. And as some have already referred to, the access to an NHS dentist in Somerset, it's fallen from over half back in 2015 to less than a third, 32% this year. Over half the constituents who contact me did have an NHS dentist, which was then, they were told, going private, so they lost it. And that decline has been consistent. My constituents having to travel out of county, and as I referred to in the chamber a couple of weeks ago, one of my constituents, a cancer sufferer, is having to use her savings to pay for dental treatment that she is entitled to free on the National Health Service, but having to use her savings to do that, suffering stage 3 cancer. In Taunton and Wellington, of course, we do share many of the problems of other areas across the country, and in particular the terrible state of the dental contract, which is at fault at the root of much of this. Now, I've met with the chair of the BDA, as honourable members have opposite. They definitely want a timescale for the negotiation of the new dental contract. And I really hope the Minister will say something about that and give a clear timetable for those negotiations so that we can have a new contract, which is really what's needed to unblock this. If we're going to train and equip the profession for the future, which is what we need to do, we have to end the uncertainty which is exacerbating the drain from the profession, the retention crisis, which is what we've seen over the last few years. It's really vital that uncertainty comes to an end. And uncertainty hits in other ways as well. For example, we all want to see more housing, certainly on these benches, and I know on the government benches want to see more housing built. We want those housing developments to be infrastructure-led, with the GP surgeries and the dental surgeries put in, and developers could contribute to those surgeries. But what would be the point in building surgeries if they're going to lie empty and unstaffed by the dentists that we need? So I really would ask the Minister also to consider whether there can be a requirement on ICBs to make sure that where those facilities are provided, ICBs would support with finding the dentists to go into them. Finally, Mr Vickers, I'd like to just put on record the really huge underspend in Somerset of £11 million last year, when children, pregnant women, cancer sufferers are all being denied free treatment, and there's £11 million sitting in the coffers. I mean, it's a scandal, Mr Vickers, and I would hope the Minister would also please consider ensuring that money will be ring-fenced year on year so that it is ultimately spent on the patients that need to receive that treatment. So finally, Mr Vickers, I therefore urge the Minister both to give a timetable for the negotiation of the new contract and to safeguard those underspends so that that money can be used to help patients in Taunton and Wellington, in Somerset and in the South West as a whole. Thank you.
An OFA.
For chairing this really essential, I think, debate about dentistry in the South West. My mailbox is filled up with people complaining about lack of NHS dentistry, and we've heard all the horror stories. And the other thing is, as a GP, I see people staggering into my surgery holding their face, and they can't get any. I know nothing more about teeth than anyone else here, but we have to try and treat them with painkillers and antibiotics because there's nothing else available. So we must change this. I thought what I'd do is very quickly talk through the dental contract and then have a couple of positive stories, perhaps to stimulate the Minister into what could lie ahead. So the current contract, as you say, I think nationally it's 86 million underspent, which is absolute madness, really. But the reason that is because it's an incredibly restricted and restrictive contract. There's very poor funding for these UDAs, units of dental activity. Yes, certainly.
The £86 million underspend related to the South West in particular.
Well, yeah, but that's even more shocking, isn't it? And the other thing is there's actually disincentives in the contract to taking on new NHS patients. And there's all sorts of other things when you look into it. So, for example, you can't provide urgent NHS dentistry unless you've used up your quota of UDAs, of units of dental activity. So you're issued these at the start of the year and you can't actually do any emergency dental work. So it's the whole system is crazy, which is why there's such a massive saving. And of course, dentists are leaving, as we've heard, and also we're not training enough dentists. That's quite clear as well. And I accept what you're saying about how dentists are trained and where they're likely to end up working, because that's incredibly important. Now, solutions. First of all, we've got to get prevention, and dentistry is really exceptional because actually dental treatment is preventative in its own right. So as soon as you strip away NHS dentistry, you immediately get problems. We have to make sure diet is better in young people. And I also like to say about a project that myself and a dentist, Kerry Mellish, have developed in our area, where she sees young children under 5, preschool, as a quick look in their gobs, and if there's signs of decay, they are whipped out and given treatment, and otherwise, if there's any other signs, you can give them fluoride enamel. And these type of innovative solutions are really, really important. One of the things that happened with the pandemic is NHS dentists stopped registering new patients. Now, if you think the pandemic started in 2020, that means that almost all preschool children are likely not to be registered with the dentist. So that's a real disaster. And just remember, 2/3 of general anaesthetics in children are done for dental reasons, which again, general anaesthetic is not without risk.
Would you want to give way on that?
Certainly, yes.
Thank the member. I congratulate the member for this important debate. I apologise. I'm an interloper from the West Midlands, but I thought it was such an important debate that I would just come and add some thoughts. And my honourable colleague has hit on a point that, as a father of a toddler, I have that struggle every day to ensure that he brushes his teeth. But that gap in the number of registrations pre-COVID is creating a generation of children that is not used to going to the dentist. And we've got to reverse that trend, otherwise we are going to have huge problems as a society moving forward about treating teenagers and adults who have never been to the dentist, who have severe dental problems.
Yes, thank you very much for that. Absolutely true. And also simple things like dental brushing, which we actually introduced before the election in the Stroud area, are really essential. And those sort of things are often sort of rather laughed at, but they're probably the most important thing that we do as a government. So one other quick win is about urgent care. Now, what happened in Gloucestershire ICB, and particularly in the Stroud area, was that what they did was that they got able to pay more on the units of dental activity and allowed all NHS dentists to do it. And in that way spent some of that 86 million that you talked about, and we were able to quadruple the number of urgent appointments that we can do. So we can do that on a smaller scale. I suggest what we need to do in this country is do it stepwise, get the prevention in place, start doing urgent dental care, and then when we have enough money, because it's all very well saying about this fantastic NHS dentistry, we do need the funding for for that, and we do need to get taxes to pay for that, and that's something that, as a government, we are responsible for. But in the long term, we need to look to universal NHS dentistry in this country. Thank you very much.
Thank you, Mr. Mayor. Thank you for ably chairing this debate, and I'd like to thank the member, my friend, for I was about to call you Tiverton and Honiton, but actually I think you might have moved on since then to Honiton and Sidmouth, although I often think it should be the ward and swap them round a bit. But Torbay, where I represent, sadly is a dental desert. We have more than 2,200 people on our waiting list, desperate to be receiving support from a dentist. I fear that that is just a shadow of what the reality of need is there, because people think that it is a forlorn hope to be able to register for a dentist. More than half people of Torbay, adults, have not seen a dentist in the last 2 years. More than a third of children have not seen a dentist in the last year. This is a cocktail of severe dangers for the health of our communities across the United Kingdom. I've spoken to a number of residents since being elected, and I just wanted to share a couple of examples of how this is impacting on real people. One of them told me that she was halfway through treatment of resolving challenges within her mouth when her dentist withdrew, leaving with a half-done job in her mouth, and she still suffers with pain and upset around her dentistry needs. Another resident, Kirsty, tells me that she suffers with a condition that could mean that she is highly likely to develop mouth cancer. She is meant to receive 3 monthly checks, and yet, as she has no NHS dentist, and she cannot afford a private practice dentist herself, she's having to go without. And this is resulting in severe depression and her having to medicate herself around these depression issues. This is not where the United Kingdom should be. Coastal and rural communities face real challenges in dentistry. We know that when you look at the national picture, the urban areas tend to be quite rich for dentists, and it is our far-flung areas that are much more challenged. So I have a couple of questions for the Minister. I'm delighted that we're looking at around 700,000 new emergency appointments, but how many of those will actually happen in Torbay? And on the renegotiation of the dentist contract, how will you be able to take account of rurality and coastal issues as part of the mix? Thank you, Mr. Chairman.
Thank you, Mr. Vickers, and thank you to my honourable friend for securing the debate. Last year, a staggering 58% of children in South Gloucestershire were not seen by an NHS dentist, despite the NHS recommending that under 18s see a dentist at least once a year. And when you talk to dentists, it's not surprising. As we emerged from the pandemic, one local dentist stopped NHS work for all, including children. When I spoke to them, they were clear the contract was at fault. But they also explained they would have liked to continue NHS dentistry for children, but NHS South West was not supportive. The last Conservative government failed to fix the broken contract, and the new government has yet to show they grasp the scale of the challenge. So we're calling for an emergency rescue plan, including using the underspends that have been referred to today to boost the number of appointments. I'd like to just mention a couple of examples from my inbox. The first that I alluded to recently in the Honourable Member for Chippenham's adjournment debate on rural NHS dentistry. A constituent who had to retire from his job due to health and mobility issues is entitled to free NHS dentistry, yet has been unable to find treatment anywhere near where he lives. Facing a dental emergency, he ended up having to seek private treatment because of the pain he was in. He struggled to afford it, but felt he had no choice. He later was experiencing another painful dental issue. This time when he contacted the NHS, they told him there was provision, but because he was now registered, it was unavailable to him. It was only available to unregistered patients. And because of this, he had to pay £95 for a small temporary filling at a private practice. And he was then told he was not entitled to be enrolled as an NHS patient as he was registered as a private patient with the practice. I hope the Minister will agree to look into this situation to ensure everyone can get the care they need. And the other example I want to draw attention to is the issue of people missing appointments. So a constituent of mine got in touch to complain that although he's one of the lucky ones in the area who's still able to access dental treatment on the NHS, he was shocked to see a sign saying that 39 people had missed their appointment last month. And staff confirmed that that was the number of people who missed appointments at the practice, this is just one practice, with no warning or formal cancellation. And they said that was actually quite a low number, it was regularly much higher. And because these appointments are no-shows, not cancellations, the slots couldn't be offered to other people desperately in need, and that resulted in the equivalent of more than 8 days of lost work. Now, this brings us back to the question of a contract. How can we make sure that dentists are being rewarded for their time, because this adds to the problem that they're not being remunerated in a way that enables them to continue NHS work. And it also is a question of making the best use of limited resources. So I'd welcome the Minister's thoughts on how we ensure this happens. So in closing, over 12 million people were unable to access NHS dental care last year. That's more than 1 in 4 adults in England, and 3 times as many as before the pandemic. And I would like to echo my honourable friend's comments about the challenges, particularly in rural areas, and look forward to hearing the Minister's comments on that. We've been warning about the issues for years, and yet there's been little decisive action to address this crisis. The British Dental Association has been pushing hard to get the government to ditch the current failed dental contract and instead move to a more prevention-focused, patient-centred system that rewards dentists for improving the overall health of the communities they serve. So, in short, I welcome the warm words from the government on dentistry, but we need more than words, we need action. And I urge this government not to kick the can down the road as the previous government did. Thank you.
Bennett.
Thank you, Mr Vickers, and it is a pleasure to serve under your chairmanship today. And I'd like to begin by thanking my honourable friend, the member for Honiton and Sidmouth, for bringing forward this debate, the strength of contribution from members on all sides of the House who have come here from the South West today to discuss dentistry in the South West shows how important it is for everybody. And I would also like to thank my honourable friend for bringing the debate about the South West, because as somebody who grew up in Gloucestershire, my dentistry as a child began in Tewkesbury. And the honourable member for Stroud's comment that dental treatment is preventative in its own right, I felt was really helpful. For indeed, thanks to my mother, Christine, her insistence on me going to the dentist twice a year meant that I never got a filling until I was into my 40s. And so for that, I would like to thank my mum. So while I welcome the government's injection of funds into the NHS as a whole, we must be clear that dentistry shouldn't be forgotten. And that is why I, along with many of my Liberal Democrat colleagues, have today written to the Chancellor of the Exchequer asking her to reconsider the proposed increases in national insurance contributions for employers, specifically for various healthcare providers, including the dentistry sector, and those who are providing NHS dentistry. And commenting on that letter, the British Dental Association have said that these changes, should they go ahead, will inevitably punish patients. Indeed, today I have had meetings with the National Care Forum, with the Children's Hospice Charity Together for Short Lives, and then I've come today to today's debate on dentistry. And all 3 of those meetings have raised grave concerns about the impact that those increases in employers' national insurance contributions are going to have on the work that they do, the potential cuts that they will be facing in terms of the people they employ and the services that they offer. So I would like to ask the Minister to urge his team in the Department of Health and Social Care to reconsider and to press the Treasury to rethink that, or at least look away at finding some form of dispensation. As honourable members have said, tooth decay is the most common reason for hospital admission in children between the ages of 6 and 10. And thanks to a Freedom of Information request commissioned by the Liberal Democrats, we know that over 100,000 children have been admitted to hospital with rotting teeth since 2018. This is shameful, and yet it's also entirely preventable, and that's what makes it so tragic. Our failures stretch across the full breadth of age groups in society. Last year, a poll commissioned by the Liberal Democrats revealed that a shocking 1 in 5 people who failed to get an NHS appointment turned to DIY dentistry. And indeed, during the general election, I knocked on the door of somebody and he told me he had pulled his own teeth out. It's simply Victorian that this is what's happened to dentistry in our country in 2024. Meanwhile, the Darzi review showed that only about 30 and 40% of NHS dental practices are accepting new child and adult registrations, respectively. For our dentistry system to be in a position where people feel the need to pull their own teeth out is, to me, and I think probably to everybody in this room, absolutely appalling. The South West is clearly feeling the full force of this crisis, and the area lost over 100 dentists last year alone. But of course, the issue with dentistry is not limited to the South West. And in my own constituency of Mid Sussex, of the 13 dentists there, only 1 is currently accepting children as NHS patients, and there are none that are accepting adults. Using data from the House of Commons Library, it's estimated that 44% of children in West Sussex did not see a dentist in the year to March 2024. My Liberal Democrat colleagues and I are calling for 3 things, and we have a plan to make them happen. First, we need guaranteed access to an NHS dentist for everyone needing urgent and emergency care. Second, we need guaranteed access to free NHS checkups for those already eligible. That's children, new mothers, those who are pregnant, and those on low incomes. And third, we need guaranteed appointments for all those who need a dental check before commencing surgery, chemotherapy, or a transplant. We can achieve these vital baselines in dental care by first delivering a dental rescue package. This would invest in extra dental appointments, fix the broken NHS dental contract, and use flexible commissioning to meet patient needs. Second, ensuring a proper workforce plan for health and social care is written into law. This would include projections for dentists and dental staff. And third, by reversing the previous government's cuts to public health grants to support preventative dental health care. We must tackle the root causes of this oral health catastrophe in the South West, focusing on investment in prevention. In doing so, we can put an end to the suffering of so many children and adults, take away the need for DIY dentistry, and provide some much-needed respite for the NHS system as a whole. Thank you.
Dr. Caroline Johnson.
Thank you, Mr Vickers, and it's a pleasure to serve under your chairmanship. Firstly, can I congratulate the Honourable Member for Honiton and Sidmouth for getting a debate on this important subject, and also for securing it at such a significant time of 2:30, which I thought was particularly skilled of him. The reality is that... I thought you'd like that, Mr Vickers. The reality is that nobody should have painful teeth. Nobody should have difficulty accessing an NHS dentist. And I know that Lincolnshire, my constituencies in Lincolnshire, suffer similar challenges with NHS dentistry access. And indeed, I had an adjournment debate on the topic back in October 2021. The Minister has pointed out, as our honourable members have today, that it's not the number of dentists that's the issue. In fact, we have got more dentists per capita than we did 10 years ago. But they're either in the wrong place within the country, concentrated in urban areas, not in rural and coastal areas, or they're not performing NHS work for a variety of reasons. And that leads us to the underspend that people have described. There has been some progress. 500 more NHS dental practices were accepting NHS patients as a result of the Dental Recovery Plan. And in 2023, there were 6 million more dental treatment processes completed than in 2021-22. And one of the things that helped with that was the patient premium for new patients, because when a dentist sees a new patient, they're more likely to have a problem with their teeth that requires treatment than if they're seeing a repeat patient. And so they're more expensive to treat, and therefore the contract, as it currently sits, disincentivises the seeing of new patients. So the patient premium is funded until April 2023. Could the Minister tell us if he plans to continue the patient premium, 2025, sorry. Could the Minister tell us if he intends to continue the premium beyond that date? Another thing that has helped is the Golden Hello of up to £20,000 for underserved areas, including the South West Midlands and East Anglia. Can he tell us if he's going to continue those? A long-term workforce plan has been mentioned by a number of members, and already there are additional places in the South West for dental training, but as my honourable friend for South West Devon pointed out, there can be challenges in the way the training is organised, which means that people don't stay in the local area, although more do than if they had been trained elsewhere. And I'd ask him to look in detail at the problems that she has raised. Ultimately, having more dentists, we have more dentists than ever before, but private is so much more lucrative than NHS, and the NHS contract is complicated and offers disincentives, and it needs reform. The previous government did begin reform to the 2006 contract by increasing the UDA rate to £28 as a minimum. The Labour Party said that they would have, well, they had a manifesto promise that said that they would negotiate with the BDA. Could the Minister confirm if negotiations have started, and if they haven't, when he expects them to start? I'll give way, yes.
I've just been rereading the 2010 Conservative Manifesto, which was a delightful read, and on page 47, it promises full dental contract reform. I then was looking at some comments made by Conservative ministers in 2024, where there was a promise to consider dental contract reform. Could the Honourable Lady explain why no meaningful reform happened over those 14 years of Conservative government?
Well, I think it's implied to say there was meaningful reform. I think there was reform, but it hasn't been enough to ensure that everyone gets a dental appointment. And it does need further negotiation, and it does need further reform. And I think it's upon, you can relitigate the election, but the Labour Party have won a majority for this term, and they need to use it to do what they promised. And one of those things was reforming the contract, and that's why I'm asking the Minister to tell us if he has indeed entered negotiations to do so. One of the things they have done, and this was brought up by the members for Mid Dorset and Mid Sussex, so Mid Dorset, North Pool and Mid Sussex, and that is they've increased the national insurance contributions, and lowered the thresholds at which they're paid, which is making it challenging for dentists across the country. I know the BDA have written a letter to the Chancellor about this, asking for an exemption, and I wonder if the Minister could comment on those exemptions. I know that I've been issuing a number of written parliamentary questions, and the answers I've received have been less than satisfactory and not really a proper answer at all, in my view. It doesn't seem that the government has either worked out how much it intends to mitigate the national insurance contributions, or for whom, or how much it might cost, which is clearly a great worry. The other question I have is the Health Service Journal published a leaked letter suggesting that the 700,000 extra appointments and presumably the national insurance contributions in many cases have to be found within the current budget. It's been suggested by the Department of Health that this letter was never sent and therefore may be inaccurate. Could the Minister put on record the reality of the situation? Is it going to be expected to be within the current budget regime, or will there be extra money, and if so, how much? The Minister has said himself that water fluoridation is safe, effective and reduces tooth decay. So will he be adding fluoridation to our water? He said in a parliamentary question answer that he would do it in due course. Could he give further information on what in due course means and how quickly he expects to do it? The government has talked the talk on prevention, now it needs to provide action. The previous government did a tie-in consultation looking to see if newly qualified dentists could be tied into working for the NHS for a period of time. What is the government assessment of this consultation, and what does it intend to do about it? The supervised toothbrushing is an interesting plan, but what about children of other ages? And what is being done to encourage parents to take the responsibility that they have to ensure that their children's teeth are cleaned? The armed forces families do move around the country a huge amount, and our forces do an excellent job in keeping us safe. The previous government, the Conservative government, brought in the Armed Forces Covenant to protect our armed forces and their family. Can the Minister say what plans he has to ensure that as families move around the country, they're able to access NHS dental care without having to wait for a place, not get one, and then move again and have the same problem? I think it was a member for Honiton and Sidmouth who brought out the issue of international dentists. An international dentist with equivalent qualifications can work in the UK privately, but they need to go through an additional process to work for the NHS to be on the performers list. which I think is unnecessarily complicated. Can the Minister describe what he's going to do to help ensure that if a dentist is able to practice on private teeth in the UK, it can also practice on NHS teeth, or does he think that's not the right thing to do? Other members have mentioned fluoride varnish. Can the Minister tell us whether he has a plan to ensure that young children have access to this treatment? And finally, Joe Stevens has said that in Wales, the Labour will take inspiration from Wales. Given that Wales has currently got dental activity levels at 58% pre-pandemic compared with 85% in England, and that 93% of practices in Wales are not taking on new adult NHS patients, which is higher than the rest of the UK, can the Minister reassure us that that is definitely not the case? Thank you.
Thank you very much indeed, Mr Vickers, and it's a real pleasure to serve under your chairship. And I'd like to congratulate the Honourable Member for Honiton and Sidmouth for securing this very, very important debate that we're having today on NHS dentistry in the South West. My right honourable friend, the Secretary of State, has said that this government will be honest about the problems facing the NHS, and we will be equally serious about tackling them. Now, the truth is that we are very, very far from where we want and need to be. Lord Darcy's report laid bare the true extent of the challenges facing our health service, including NHS dentistry. And even he, with his years of experience, was shocked by what he discovered. And I'd like to pay tribute to all of the honourable members across the House, too many to name in the short time that's available to me, for helping to highlight and elucidate their concerns, in many ways what Lord Darcy set out. But what we heard today, I think, was some heartbreaking examples, frankly, about the experiences that our constituents are having, and I think colleagues really brought that to life today from across the House. Now, Lord Darcy's report is vital because it gives us the frank assessment that we needed to face the challenges honestly. And Lord Darcy is clear that rescuing NHS dentistry won't happen overnight. But we will not wait to make improvements to the current system, to increase access and to incentivise the workforce to deliver more NHS care. We inherited a broken NHS dentistry system. It's truly shameful and nothing short of Dickensian that the highest cause of children between 5 and 9 years old being admitted to hospital is to have their rotten teeth removed. It is frankly disgraceful. Those are the sort of challenges that we need to face. 13 million people in England have an unmet need for NHS dentistry. That's 28% of our country. It is absurd that people can't access NHS dentistry when each year the budget is underspent. In recent years, that's been to the tune of hundreds of millions of pounds worth of care going undelivered. That's why we need to reform the dentistry contract. In NHS Devon Integrated Care Board, which includes the Honourable Member for Honiton and Sidmouth's constituency, 34% of adults were seen by an NHS dentist in the previous 24 months to March 24, compared to an average of 40% in England. And in 23-24, there were 40 dentists per 100,000 of the population, whereas the national average across all integrated care boards was 50 in the same year. We acknowledge that there are areas of the country that are experiencing recruitment and retention issues, including many rural areas where the challenges in accessing NHS dentistry are exacerbated. But as Lord Darcy has said, we have enough dentists and dental care professionals at an aggregated national level. The problem is that not enough of them are doing NHS work in the right parts of the country where they're most needed. So the mountain that we have to climb is daunting. But we, this government, are not daunted, Mr Vickers. And we're working at pace. Take, for example, the Golden Hello scheme, which will see up to 240 dentists receiving payments of £20,000 to work in those areas that need them most for 3 years. ICBs have already started to advertise those posts through the Golden Hello scheme, and nationally there have been 624 expressions of interest, and 292 of those have since been approved. 38 posts are now being advertised with, of course, the incentive payment included. Or take our rescue plan. that will help to get NHS dentistry back on its feet by providing 700,000 of additional urgent appointments as rapidly as possible. Now, we know that rescuing NHS dentistry means acknowledging that we need more dentists doing NHS work. And we know from survey data that morale among NHS dentists is low. We must turn this around. And this government will do all it can to make NHS dentistry an attractive proposition. Strengthening the workforce is key to our ambitions, but for years the NHS has been facing chronic workforce shortages, and we have to be honest that bringing in the staff we need will take time. We're committed to reforming the dentistry contract to make NHS work more attractive, boost retention and deliver a shift to prevention. There are no perfect payment models, and careful consideration needs to be given to any potential changes to the complex dental system so that we deliver genuine improvements for patients and for the profession. We're continuing to work with the British Dental Association and other representatives of the dental sector to deliver our shared ambition to improve access to treatments for NHS dental patients. The Secretary of State met with the BDA on his first day in office, and I engage with them regularly, including meeting them just earlier this month. I share the BDA's desire for a timeline for negotiations, but we've had to wait for the budget and the ensuing discussions with Treasury to initiate and conclude those discussions. I will briefly give way.
Minister, able to say when the timeline will be available for those negotiations?
Minister.
Well, as the honourable gentleman will understand, we're in a sequence. We have the budget, we have the complex negotiations around the spending review. We can't really engage in meaningful formal discussions and negotiations until we're clear exactly what the financial envelope is. That we're working on pace at that, but we have been meeting informally to sketch out and scope. So what I would say is the scope of the negotiations is agreed. The formal negotiations will only really start once we have the detailed budget in place. We'll listen to the sector and learn from the best practice out there to improve our workforce and to deliver more care. For example, I know that the integrated care boards in the South West are applying their delegated powers to increase the availability of NHS dentistry across the region through other targeted recruitment and retention activities. This includes work on a regional level to attract new applicants through increased access to postgraduate bursaries, exploring the potential for apprenticeships and supporting international dental graduates. There are also 2 dental schools across the South West, the Bristol Dental School and Peninsula Dental School in Plymouth. I recently had the pleasure of visiting Bristol and seeing the excellent work that they're doing there, training the next generation of dental professionals, supporting NHS provision by treating local patients and reaching underserved populations through outreach programmes. I also know that Peninsula Dental School, which first took students on in 2007, is doing the same for Plymouth and surrounding areas. And I'd also like to pay tribute to Patricia Miller of NHS Dorset, Leslie Haig of the Health Service University and Millie Earle, Council Leader, for working so constructively with my honourable friend on expanding oral health in his Bournemouth East constituency. Moving on to prevention, a number of honourable members have rightly highlighted the importance of prevention, and we're working around the clock to end the appalling tooth decay that's blighting our children. We will work with local authorities and the NHS to introduce supervised toothbrushing for 3 to 5-year-olds in our most deprived communities, getting them into healthy habits for life and protecting their teeth from decay. We will set out plans in due course, but it's clear that to maximise our return on investment, we need to be targeting this at children in the most disadvantaged communities. And in addition to that scheme, the measures that we are taking to reduce sugar consumption will also have a positive effect on improving children's oral health. Separate to the national schemes, I was pleased to note that NHS Devon Integrated Care Board has also committed £900,000 per annum for 3 years to provide support for further cohorts of children for supervised toothbrushing, fluoride varnish and open wide step inside, with a new fluoride varnish scheme due to go live in September 25. Open wide step inside is a local scheme where a dental outreach team run by the Peninsula Dental Social Enterprise go into schools to deliver 45-minute oral health education lessons across Devon and Cornwall, a truly commendable scheme. Now, the steps we take in NHS dentistry will feed into the wider work we're doing to fix our broken NHS. We've committed to 3 strategic shifts. from hospital to community, from sickness to prevention, and from analogue to digital. Our 10-year plan will set out how we deliver those shifts to ensure that the NHS is fit for the future.
Iterated the problem. He's given warm words about listening, talking, working with people. He's given little concrete except for things that were happening already, either locally or as a result of the previous government. So with a minute left to answer all the questions he's been asked during the debate, can he commit to answering and writing those he doesn't have time to answer in the remaining minutes?
Minister.
Well, the first thing I'd say is I'm not going to be taking any lectures from any member of the Conservative Party about the state of our dental system. The brass neck that we see from the party opposite, both in the chamber and in this place, lecturing us after the disgraceful state of our NHS, where we live in a country where 5 to 9-year-olds, the biggest cause of them going to hospital is to have their rotten teeth removed. I will not be taking any lectures on this from the party opposite. But of course, I'm more than happy to answer the honourable lady's detailed questions, many of which I feel that I have actually answered in my preceding comments. I won't be taking any more interventions from her because I need to finish very shortly. Our 10-year plan will set out how we deliver these shifts to ensure the NHS is fit for the future. To develop the plan, we must have a meaningful conversation with the public and those who work in the health system. So we're going to conduct a range of engagement activities, bringing in views from the public, the health and care workforce, national and local stakeholders, system leaders and parliamentarians. I urge honourable members from across the House to please get involved in this consultation, the largest in the history of the NHS, change.nhs.uk. Please make your voice heard also in your constituencies through the deliberative events. I'll give way briefly.
Slade.
Can I just say I have been onto the survey. It is incredibly limited, and it would be really helpful if there was a way that members of the public could be encouraged to introduce more free-form responses to the survey. Thank you.
Minister.
I thank the honourable member. I'm slightly surprised to hear her say that, because certainly the presentation I received on the portal showed that there was quite a clear sort of channel through to being able to have a more discursive engagement with the platform. But I will take that feedback away and certainly through officials we'll come back to her on that point. So I'd like to thank the honourable member for Honiton and Sidmouth once again for bringing dentistry in the South West forward to this debate today. On the 4th of July, we inherited a profoundly challenging fiscal position, but I can assure him that we remain committed to tackling the immediate crisis facing NHS dentistry, and that we're also taking steps to make delivery more efficient through long-term reform. To recap, we're committed to providing 700,000 more urgent dental appointments, delivering the Golden Hello scheme to recruit more dentists in area of greatest need, bringing in preventative measures to improve our children's oral health, negotiating a long-term contract reforms to make NHS dentistry more attractive going forward. These steps will help tackle the place-based disparities that are commonly seen in dentistry and ensure that everyone who needs access to NHS dentistry can do so, including in the South West. Mr Vickers, our NHS dentistry is broken after 14 years of Tory neglect and incompetence. But it is not beaten. In 1945, it fell to Clement Attlee's Labour government to create a health system for the 20th century. Now, 79 years later, it falls to this government to clear up the mess that we've inherited, to get NHS dentistry back on its feet, to build an NHS dentistry service that is fit for the 21st century. And that is what we shall do. Thank you.
Ford to wind up.
Thank you, Mr Vickers. I acknowledge what the Minister said a moment ago about the Conservative government's legacy for NHS dentistry, and I think that's apparent for us all to see. The Health Service Journal revealed last month that in Devon and Cornwall, the wait for an NHS dental appointment for a new patient is now 1,441 days. That's almost 4 years. Mr Vickers, many of my constituents really cannot wait that long. And so I'm hopeful that the Minister has heard not only the examples of pain and suffering set out today, but also some of the prescriptions proposed by the Liberal Democrat spokesperson and other MPs from across the West Country. Thank you.
The House has considered NHS dentistry in the South West. As many of that opinion say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order.